Well, hello there. It's been a while since I've done any videos. Recently I had a journey, and I'm still on that journey. And for those of you who don't know me, I'm Marie. My name's Marie, and I'm a 54-year-old mother of one. Single mom, and I recently just had a journey with basal cell nodular kind of skin cancer. It's not the most deadly cancer in the world. It's usually superficial, but from some of the videos that I've been watching, I'm not a doctor, it could probably be the most destructive of all the skin cancers if you don't get it taken care of right away. So my journey starts with this. I want to show you what it started as. Now, my skin cancer probably started way before April 25th, 2022. That's the first picture I found it in, where you could see the spot. And then in 2023 is when I noticed it getting worse. Now, I thought it was just a pimple. I thought, hey, it's where my glasses were. I just thought it was something about that. And maybe I've gotten a wart in my hand before, and when I used compound W on it, I found a piece of glass at the end of it where the wart grew over it. So I figured I got something in my skin, and it was just skin was just growing over it. So I tried to heal this myself starting in February, using, first Arm & Hammer, trying to pull whatever was in it out, and then I would put Manuka honey on it, and I was trying to heal it, and then I would put some coconut oil on it, and it just kept growing. As you can see, from February 17th to April 11th it grew. Then it looks kind of the same to July 6th, but when the doctor measured it from April 11th to July 6th, it had grown a little tiny bit. Now, back in February, between February and April 11th, the scab fell off, because it did have a scab, but it kept scabbing over. The scab fell off, so this type of skin cancer does have a scab sometimes. I don't know if it's all the time, but this was my particular experience with it. And I'm an experiencer, I'm not a doctor, and the coconut oil seemed to soften enough to where it came off itself. But then when I looked at it closer, it had blood vessels going to it. And I'm like, oh crap, that's skin cancer. I gotta call the doctor to have them check this out. So I called my doctor, and it was very difficult to get in to see a dermatologist real quick. They're booking out way out in advance. They're over. Yeah, I was lucky to get one in July. An appointment in July. July came around. They did a biopsy. What they did was they numbed it. And I'll tell you one thing, the needle hurts for a few seconds. They gave me I had stress balls I was holding on to, and it's just a needle. And then once you're numb, you don't feel anything. And it's like so quick. She does it, and then she puts a bandage over it. You keep the bandage on it so, you know, the bleeding will stop. And then, you know, of course, it's got to heal a little bit. Whatever, the cancer heals or not. And then you're done. I mean, sometimes with skin cancers, they can just, like, I had a wart. It turned out to be a wart. She wasn't sure what it was on my arm, but she took that one completely off, in office. Numbed it. That numbing agent didn't hurt as much as the face did, though. The face does hurt because there's not a lot to whatever. It's right next to the bone. There's a lot of nerves in that area, and it was so close to the eye that she could not take it off completely. She had to do the biopsy. Biopsy came back. It was basal cell skin carcinoma, nodular type. I guess there's different types. Those things you have to talk to your doctor about. I don't know. So anyways, that concluded that portion of the skin cancer. Finding it, realizing it to me that it was skin cancer, and then actually getting in to see the dermatologist finally, and having them do the biopsy and confirm a diagnosis of basal cell skin nodular type carcinoma. Now I'm going to walk you through the process of getting MOHS surgery for this type of carcinoma because of where the area it was in. It was a difficult spot. It required something more than just lancing it off or, you know, taking it off the way she did on my arm. It's called MOHS surgery, and what they do is they go in, they take the cancer out, and right on the spot they'll go in, check it out, you know, they'll slice up the cancer after they take it off, and the doctor checks it out under a microscope to make sure they got all the cancer. If they still have cancer in the perimeters, up and, you know, down deep and all around, then they go in and they take more until they got it all, and they keep doing that till they got it all. My skin cancer, I was lucky. They got it all in one shot. The thing is she took all the skin from top to bottom off. You can actually see in the hole she made, you can see my cartilage in my nose, so I know, and I could see the skin, you know, the where it ended in the edges. I will show you that graphic picture. I will let you know when it's there, and then I'll let you know when I take it down. After that graphic picture, I got a little bit more of a PG picture I created so that it's not disgusting, you know. But I'm the type of person, I like to know everything, so it really doesn't gross me out to see something like that. It took me aback because that was me and that was my face, but I decided we all have choices to make, and I decided no matter what I look like after the surgery, I've always been self-conscious of my looks because I've always been called ugly. And I don't care who calls me ugly, you know, even after the surgery, even if I have a scar, even if, you know, it looks funny. It's what you can't see that makes it pretty. And that's, the cancer's not there. I don't have skin cancer there anymore. And so I don't care what anybody says. It's, the body to me is just a vessel. It just houses our spirit, you know. It's not who we truly are. It's our body. It's our, you know, it's made to decay, and it's made to go back to the ground. So, I made the decision not to be upset about how I looked, about my looks. And that decision came quickly. And, I mean, the skin cancer looked bad too. So, and it could have gotten way worse. I've seen other graphic pictures. One guy lost his eye and everything. It was disgusting. So you really don't want to put off if you find, I mean, I put it off too long. My therapist was telling me way back when I was trying to heal it myself that I should call and have them check it out. But no, me, I was pig-headed. I'm going to heal it. It's just, you know, something, dirt or something got in it, you know, whatever. That's just the way I am sometimes. So anyways, this picture here, that ugly picture that we've been looking at, this is the spot right the day before my surgery. I had the surgery on a Wednesday on the 9th of August of 2003. I know it's not that far away. You know, it was last week. So I do have a bandage over my nose. You know, I still have the bandage over my nose. I don't have to take Tylenol. It doesn't hurt. But it is, you know, I do have to take care of it. So what to expect? You go in, hopefully you have really nice people, which usually they are. You know, they got other patients they're seeing, so it's like I tried not to be a pain in the butt, but I overtalk when I'm nervous, so I tried not to be a pain in the butt. And this particular, it stopped recording on its own, but this particular place, you went in, it's Yukon Health Center is where I went, dermatology, and you go in and you take the elevator to the second floor, and then it's to the left, is your MOHS Surgery, MOHS Surgery area, and you wait to be called, and they check you in, and then you have a seat. I'm trying to guide you through it. Farmington was very, very good. Yukon was these people were above and beyond. But this place, you went in, you're having your seat, and then they do give you access to internet if you need it, you know, for your phone, because when you're having the surgery, you're awake. You don't feel a thing. Just to let you know, you do, but you don't. I'll let you know a little bit further in here. They let you use your phone in the back. They have internet connection that they will let you use. They also have television, you know, while you're waiting. And they bring you, a nurse or a PA, the assistant to the surgeon, to the dermatology that's doing this surgery, will call you in. There is one assistant to each patient, so whoever calls you in, you're gonna be with, you know, usually very nice people. I had the sweetest lady. She explained everything to me that they were doing. She took my history. She just stayed with me throughout the whole process. She didn't leave me, and she explained everything to me, and she was very, 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 very good with the questions, and would talk me. Sometimes I overtalk. So, doctor came in, did her stuff. Of course, they're making sure it's you, and they take your history again and make sure it's all correct. They do that a couple times. And Then the doctor comes in, she looks at it, makes a few marks on the face where she's going to cut, and doctor goes back out again. And so the assistant, she numbs you up. Now my assistant gave me a ball, two balls to hold on to, the stress balls, which actually made it a lot easier when we were doing it. You lay back, you know, they have a chair, they lay you back, and I am not going to lie, it does hurt. The initial pricks of the Novocaine hurt. I got through childbirth. I can think of many more things. Even a bee sting hurts worse. And what she had me do was take a deep breath in. She put the needle in, and I just kept slowly breathing that out. It hurt, yes. However, I would imagine a bee sting would hurt worse. The 5 epidurals that I got stuck with hurt a lot worse than that. I would imagine any form of, a broken bone hurts worse. It's just, you know, the initial prick that hurts, and you're done. Then she makes sure you're completely numb. That's important. She told me if I felt anything to let her know, and they would stop and numb it up. But fortunate for me, doctor came in, and once you know it, I closed my eyes, she took the scalpel. Within 2 seconds, she had the skin cancer and that done. I didn't feel a thing except for that needle initially. And I was just like, wow. Now, I also am the type of person who likes to get pictures of things. And I had told you about a picture I took. She helped me take. If I could have been in there while they were preparing the slides for the doctor to look under the microscope and then look under the microscope with the doctor, I would have done that too. But that's just me. I don't get grossed out very easily. So it's just interesting. The human body's just an amazing creation to me. So I get interested in every little aspect. So yes, I did have her take a picture of what the wound looked like before it was closed when she cut it. And I'm going to show it to you. And it's gnarly. I'm going to show you the gnarly one first, but then I PG'd it up a little bit so I can show the rest of everybody. So what I'm going to do is really quickly show the people that can handle it the picture of the hole in my face that was created by this cancer. Basically, you know, she had to cut it off, right? She had to get it out there. And then I will let you know when I put the PG picture up. Right now is when I would look away, because I'm going to be putting the picture up in 2 seconds. This is the hole she made in my face. Am I happy about that? No. But the cancer's gone. So no matter how it looks, when she closed it up, that hole, there was no other way to close that hole than to do the MOHS surgery. I'm going to take that one off right now. I just wanted to show you how gnarly it was and how unnatural it looks. And hold on, do not look yet. I will let you know. Okay, now the PG picture is up. Like I said, the perimeters of that hole, you can see I just like completely muted out what was in the hole. Alright, it's pretty gnarly. And for them to be able to fix that and make it look somewhat normal, I'm amazed at. So that's what MOHS surgery is designed to fix. Something that they had to do by cutting out this cancer. And look how close it is to the eye. Any closer, I would have had to have an eye surgeon, and they would have. Some people, she explained, do need to come back and be put under anesthesia, general, put to sleep, for reconstructive surgery. That's the first cut she made, and she got it all. And I was very pleased she only had to cut me once, as far as that goes. Now, you see the line? That's the line she created because that was where she was going to be taking and putting, it's called a flap, over that hole to fix it. So let's look at how she fixed it. Right after she went back, left that hole there, you know, they closed it up. I watched a little bit of TV. I got some snack, you know, I got some cookies, you know, they didn't have too much, and I got some orange juice, and she gave me coffee, which was very nice of her, because I got there at 8 o'clock in the morning. I didn't have too much coffee, so I was getting a headache, and Novocaine gives me a headache too. So anyways, what she did was she went back, she made that, you know, how she was going to close it up. She made that line, and I got put back in the seat and more Novocaine. This time there was like 3 shots, and it hurt. It hurt a little bit worse than it hurt with the nose, if that's possible. And I turned around and still felt a little bit, you know, I'm like, she's like, can you feel this? And I'm like, I felt something in there. I felt metal. And so she gave me more Novocaine. She made sure I did not feel a thing. Doctor comes in. They covered my eyes. They, you know, they covered everything. And she worked, and they just basically discussed, you know, we got a case here in Connecticut about Jennifer Doulos, the girlfriend of the guy who killed himself, who was supposedly, you know, Jennifer Doulos is still missing. They never found the body. In this particular, she was back in court that day, and so they were discussing that, and, you know, just getting the surgery done. And this is what they come up with. This is right after they did it. I was still sitting in a chair, and she covered that hole up completely. Now, do I think that looks great? No. I mean, it's gonna look worse before it gets better, right? Now, they put dissolving stitches in, and I learned that I'm gonna have to take the dressing they put on it off every day and clean it out and redress it. That was my first order of business. She dressed it, and then she told me how to do it. They sent me home with a care package of gauze and different things that you will need to get more of. You need non-stick gauze pads, you know, and then you need regular gauze, then you need Q-tips. You need Vaseline if they're like this. I'd ask if you were going to be, you know, caring for it at home yourself, or if they just are going to have you leave the bandage alone. I wouldn't just run out and buy all this stuff if you know, they're just going to leave the bandage alone all week. But if you have to clean it out like I do, you're going to need this stuff. And what I do is I got an antiseptic so that I can clean the skin where I'm going to be putting the tape, because the tape, you need the cloth tape. The thinner cloth tape more than the thicker one works better, I found. And you're going to need a new jar of Vaseline, because you don't want it contaminated with your fingers or anything like that. So, new jar of Vaseline, Q-tips, brand new Q-tips, what else? Oh, ice packs, because you're going to need the ice at 15 on, 45 off for the first 48 hours, to keep the swelling under control. Also, be prepared for them to tell you a few things, which I was not. For a week, I'm not to bend over. So even tying my shoes is out unless I pick my shoe up and put it on the table. I'm not to lift anything over 10 pounds either. And I have to sleep propped up. I can't lay flat. So you have to take this all under consideration after MOHS surgery, into consideration, because that's what they're going to tell you. So if you have a job that requires lifting and bending over, either, and you plan on still working the following week, then you need to get accommodations, reasonable accommodations, or get the week off so that you can heal, at home. For Wednesday, Thursday, Friday, Saturday, Sunday, or Saturday, Saturday night, no, I took Tylenol, but I haven't needed it. It doesn't hurt. Itches a little bit, doesn't hurt. The reason for the Vaseline is you cannot let self-absorbent sutures dry out. You don't want to anyways on the face. It'll, your scarring will be less on the face. So, it's of course not going to look pretty. She told me to watch out for, you see the redness, if it got totally red all the way to the other eye and all the way, and I ran a fever and I just felt generally not feeling well. That's infection. A little bit of redness. I mean, I'm going to have redness until the sutures are absorbed. You're not going to be able to go swimming for a month after. I can't go swimming for another month. And then you're going to see the doctor again in about a week, so that they can check out, see how it's doing. So I am only including these pictures to show you what to look out for, because some of the videos I found, they didn't really realize that, it's going to look worse before it gets better. I got a black eye from this. And you can see the black eye in this picture. Underneath it, that's a black eye for my skin tone. I also have a couple bubbles and stuff, but I'm assuming that stuff is the Novocaine. You gotta think that your face or whatever, everything just went through a traumatic experience, so it's gonna pitch a fit. I did have a little bleeding at the bottom there. This is cleaned out actually, and I also have a little nodular up next to the eye where the tear duct is. That grew bigger and it bothered me. And so I had a little bit bleeding up there too, which I will show you in the other pictures. But all in all, this is the first day, the day after my surgery, and it's still swollen. There is a black eye there, you can see it. Not a whole lot of redness. Not a lot of redness, but you do see like little bubbles here and there. Well, they look like bubbles on here, but I'm assuming that's where she put the Novocaine, and that's the way my skin reacted. Another thing that you're going to have to get, and I forgot to tell you, if you are going to be cleaning this out yourself, is a very gentle a soap that I use. I have Cetaphil that I use on it. I had told them Lubriderm, of course I was very nervous there, but I just wanted to let you know that too. The second day after surgery, when I cleaned it out in the morning, this is how it looked. You can still see the black eye. It's a little bit darker. It's still a little swollen, and that nodule up at the top near my eye has gotten a little bigger, and it started bothering me near the tear duct. You can tell I've been scratching it, but all in all, the scabs where it was bleeding came off. You're gonna get a little bit of bleeding, hopefully not much. I have a feeling the bottom, it's hard to cover, so what happened was I put my finger there and I kind of whatever. I've gotten it closed, the bottom nonstick pad closed right now, so that I don't touch that stitch and that it doesn't dry out. I noticed yesterday that it had dried out, so I washed my face twice yesterday instead of once. But this is the way it looked the next day, day two. There's still black sutures and stuff. But then something happened on day 3 that threw me for a loop. Now, this is that next day that threw me for a loop. It's white. I can't see the stitches at all. It's still swollen. A little bit of red, not nowhere near as red as she said it would be if it looking out for infection. It didn't hurt. It wasn't hot to the touch. That's another sign of infection. I forgot to tell you, the skin gets hot to the touch. There was no signs of infection, but it's white. That's not oozing. That's not ooze. So it could be part of the healing process, but you notice also too, those red spots have gone down. The ones that I'm assuming were from the pinpricks. My black eye is getting better in this one too. You can't really see it too much because the nodular thing is swollen still, and that's when it started really bothering me. So that night I was itching it, and you could see up at the top next to the eye that it did bleed a little bit from doing that. So I try to not itch there. Most of my itching that I get is just from the bandages around it's not, the itching is not on the sutures themselves. So I'm thinking that the Vaseline is helping it not itch too. It's keeping it hydrated and not itching, I also have been taking a multivitamin. No, it's not a multivitamin. It's hair, skin, and nail vitamin. Hair, skin, and nails. To help the healing process, and you need to drink water because you're staying hydrated on the outside. If you're not staying hydrated on the inside, it's not going to do you any good. But anyways, this is how it looks. So I will ask the doctor if this is normal. I mean, I didn't call the doctor because it's not an infection at this point. Now, this was yesterday, and now you can tell where it was bleeding, and that nodular, where it was, it's going down. The black eye's resolved. The skin's getting more even. It's a little bit red. I was told it was going to get red. And you still got that white stuff on there. That's throwing me for the loop. I'm thinking it's just because I'm using the Vaseline. I think it's just the Vaseline usage, but you never know. So anyways, there's no infection. It doesn't hurt. I'm cleaning it out. Like I said, I cleaned it out. This was the morning yesterday, and I cleaned it out one more time at night too, just to make sure. And to make sure the bandages stayed on at night, because I have the hardest time doing the bandages. I swear I was going to look like a mummy by today. But I'm getting better. I asked God to help me, and I think He has been. All glory to God, So anyways, that was yesterday. And then now here it is right now today. I'm thinking it looks a lot better. Like I said, the redness, that red, is going to be there, she said probably for about a month or so. The stitches are being absorbed, but you can see how the skin has actually went down next to the eye. It's not bothering me anymore. That's a good thing. So I haven't been rubbing the eye, but when I washed my face yesterday, I pulled a little bit at the skin. So when you're washing your face, just dab it. But I'm also using I'm not using anything but the mild soap, and which is the Cetaphil water on a gauze pad, and then I'm drying it, cleaning it off, taking the Cetaphil off. Then I'm taking a dry gauze pad and I'm patting it down. Then after that, then I'm taking and putting the Vaseline on where the stitches are. Now, the skin next to it, what I highly recommend, and I got some antiseptic cleaner that I put on a little pad of it's kind of like a Q-tip pad, but it's a pad like you put on makeup with, and I've been using it to do the skin, like on my nose and on my cheek, where I know the tape's gonna be, because this stuff is called paper tape and it doesn't stick very well. So they gave me a roll of thinner paper tape as opposed to the thicker one, and the thinner one helps things stay a lot better, just to let you know. So anyways, you, even with your fingers, if you touch anything, just wipe your fingers off with, wash them off with that, with that pad that has the stuff on, because your fingers have oils on them too. So you don't want to get oil on that tape, and you want a clean surface and something it's going to stick to, and you got oils on your face too. My face is highly oily. I think that's why I have the biggest problem with the tape, because I have oily skin. But this is today, and it looks a lot better. It really does. We shall see what tomorrow looks like, and then what the doctor says on Wednesday. So far that's my MOHS journey. So far nothing's been scary. Everything is actually better than I thought it was going to be. I mean, it's still, it's still not ideal. It's not going to look good, of course. But, when you have surgery to begin with, it doesn't look good. I mean, people have cosmetic surgery. This is cosmetic. This is a type of cosmetic surgery. And quite honestly, I don't know why people do this on purpose, because it did hurt the first couple days afterwards. I'm just like, oh boy, people do this on purpose. This is not fun. But it's scary when you can't find what you're looking for, and I looked for what to expect with MOHS surgery and what it would look like and all that on the internet. And I got a few hits, yeah, and there was one lady that explained a lot. However, I'm just gonna add my journey right up there, so, with a little bit more detail, just so that other people can not be as afraid of getting the surgery done, because you don't feel it. And with MOHS surgery, it's designed to make it so that there's less scarring and the scars aren't as visible, and it's also designed for the hard places, the places that are hard to work on otherwise, with cancer especially. So I live in Connecticut. Yukon is in Farmington. Their dermatology and their MOHS surgeons are I know the one that I had was a lady one. She's outstanding, and her helper that was with me the whole time was above and beyond. I mean, we have people that have like horror stories to tell, but I really, through this whole thing, I've had really understanding doctors and nurses, even though this cancer is not a killer and it's usually superficial. Um, I still got scared, and people understood, the doctors understood why. It wasn't ridiculous. Any type of stuff like this where you don't know what to expect. I will say that if it's on the face and you're highly into your looks, you need to make a decision. Do you want the cancer there, or do you want to look good every day? I mean, if you're not looking good just for 6 months even, where you can't wear makeup or whatever, I mean, it's a small price to pay to get cancer off your face, because if you let that cancer go and you don't have the surgery, you can lose a lot more of your face than I even did. I have now, just to let this heal, I have to go to this doctor until he releases me. I'm going to have a head to toe look at my skin now, because the skin cancer had to be addressed first. So I don't know if I have anything else kicking around on my skin. I mean, I know a few things, but they're just like warty things, or the spots that I was concerned about turned out to be no concern except for this spot. And there's a couple more on my face that I'm gonna ask her about. One of them has been in this picture. Not the one on the bottom next to my nose has been there most of my life. So I just think I can ask her what it is, and I will, because somebody asked me about it. But that's been there most of my life. There's another one that's been there for a little while, but that one has its own blood vessels too. So I'm gonna have to ask her about that one. And then, of course, I'm Irish skinned. I'm fair skinned with red hair and green eyes, hazel eyes. So, I always burned. I never cared. Well, maybe if I cared less about my looks and put on that hat that makes you look cool instead of ugly, which I thought hats didn't look good on me. But maybe if you put on that hat or use a parasol umbrella, it's better than going through this. But if you have to go through this, you need to make a choice. Skin with no cancer is beautiful. I'm enjoying taking care of my face right now, even though I'm not the prettiest as far as society goes. But, I don't care what society thinks anymore. I really don't. I care what I think, I care what God thinks, and I care what my daughter thinks. And you know what? My daughter loves me no matter what. God loves me no matter what. This body is just a vessel for us to have a short time here on earth. And it's made to decay as you get older. We can fight it every step of the way, and God bless those who do fight it, because you know. And I really want to shout out to those people who can be consistent with taking immaculate care of their face and what they put in their body, because that is very hard to do. I will do a follow-up video, with the next part of my journey, if you need it. But this is partly to be a blessing to others, because when I was talking to the lady that was in that MOHS room with me, by the way, you're in one room. You're not in with a whole bunch of people who had the surgery the whole time. You get your own room. It was really nice. She asked me, and I said, I might do a video, because it's a blessing to others. And this is how I can be a blessing to others. I don't have much. And like I said, there wasn't much on the internet I could find. Now, I want you all to have a blessed day. Have a good day. And no matter what happens in your life, try to find a little joy. After this video, look at baby videos. You know, look at babies laughing, or look at animal videos. You know, take in creation. Whether you know, no matter what you believe in, life is amazing. Consider a tree. You know, how come they don't tip over? They're you know, man-made structures have to have certain shapes and things to stay erect, but you know, in nature, and everybody's made differently, and everybody's beautiful. It doesn't matter how you're made. You're made differently for a reason. If everybody looked the same and was the same, we'd be robots, and that's no fun, and that's not interesting. Keep life interesting. Fall in love with life. And even, I'm talking the trees, the flowers, anything in nature, really. Get out there, enjoy it. No matter where your situation is in life. I get depressed too. I've had a hell year the last 3 or 4 months. It's not just been the cancer, it's been a few other things. I also had a precancerous polyp removed a couple weeks ago. So I'm hearing that word cancer too much. But you know what? I still find the joy in life, and I still find ways to be a blessing to others, and this is one of those ways. You have a great day and an even better tomorrow. Bye-bye.